So I wanted to talk a little bit about pre-implantation genetic diagnosis, or what we call PGD for short, in CADASIL. I have involvement in this because I'm a principal genetic counselor at Addenbrooke's in the clinical genetics service. So I do see patients who are going through PGD for CADASIL and other conditions. So there are lots of reproductive options for those who are at risk for CADASIL, which range from not doing anything particularly different at all and not doing any testing in pregnancy, all the way through to doing something like pre-implantation genetic diagnosis. There's also the option for prenatal genetic testing, which is done in the pregnancy after a person becomes pregnant. But today I'll be focusing on PGD, where we test very early embryos and only implant the embryos which are not at risk of CADASIL. So what is PGD? Basically it's a technique that we use to create embryos and test them for the genetic condition, and only implant embryos that don't have the factor for the genetic condition. The PGD itself involves two services. So the first is the PGD genetic service, which is where you get the counseling for the process and where they do the genetic testing on any family members in the embryos. But it also involves the assisted conception unit, or the ACU, where the in vitro fertilization part of the treatment takes place. And this is for the UK, but in general, these apply to any country where you'd be receiving these services. So how does the PGD process work? The way it begins is that a couple has to be referred by their local clinical genetics service. So they do require a referral from either a genetic counselor or geneticist. And if the couple meets the criteria for PGD, then they'd be accepted for an appointment at the PGD center. If the couple then decides that they'd like to proceed with the process, then the PGD center would organize any blood samples that needed to be obtained from the partner and or the family members, any genetic testing that may be need to be done before the process begins. And then when all of that is complete, the couple is then referred to the ACU, the assisted conception unit. And at the ACU, what happens in the beginning is that the couple would meet with a fertility specialist to talk through the process, the IVF process. If they decide to proceed, the woman would then start taking medication, which would stimulate her ovaries to produce eggs, so hyperstimulation. At the appropriate point in her cycle, then she'd be set up for an appointment where she'd be sedated and the eggs would be surgically removed. And then the eggs are fertilized with the males or sperm donors if the affected partner or at-risk partner is the male in the relationship. Sperm, and then the embryos are made. So once the embryos are made, that's where the embryo testing takes place. So the first step in the process is simply to develop the embryos to a multi-cell stage where some of the cells will be removed to actually do the genetic testing. So that usually takes about 5 days to what we call the blastocyst stage. So it's just division of the embryo into multiple cells, and this is the blastocyst. And what happens for the testing is that just a few of the cells are removed from the trophectoderm part of the blastocyst. And you don't need to remember any of this, it's just so you have this information, which is actually the outer layer of cells surrounding the blastocyst. So it's not the embryo itself, it's the cells surrounding the embryo. And then all the biopsy embryos are then frozen and stored, awaiting the results of the test, so they can figure out which of those embryos might not be carrying the genetic change which causes CADASIL. So if they succeed in producing unaffected embryos, so if they're healthy embryos that they know aren't carrying the gene change, those are then transferred to the woman's womb in the ACU. And if the procedure goes through, then the woman would take a pregnancy test approximately 11 to 12 days later. And if that pregnancy test was positive, she'd then go on to get additional testing to make sure it was a viable pregnancy, which is usually done by an ultrasound. What are the actual chances of having a baby with PGD? So these are general figures. Any specific center is going to have their own numbers. But in general, about 1 in 3 PGD cycles would result in a full-term pregnancy. One of the reasons that the cycles don't succeed is that sometimes no suitable embryos are available for transfer to the womb. And this can happen for several reasons. Firstly, there might just not be enough eggs produced through the hyperstimulation procedure, or not enough embryos will be fertilized in the first place. The embryos might not develop into the blastocyst stage. So it's not uncommon for some of the embryos just not to develop to a late enough stage where they'd be able to do the testing. Embryos sometimes don't survive the biopsy, although this is a fairly rare event, but it does happen. And sometimes all the embryos that get produced happen to carry the genetic condition. So it may be that all the embryos available actually would carry the gene which causes CADASIL, in which case they would not be implanted. However, if healthy embryos are available, are created, then each embryo that's transferred has a 1 in 2 chance of resulting in a pregnancy, or a 50% chance. So for each embryo transferred, there's a 50% chance that it would result in a pregnancy. So you can see, even if you go through the process, there's no guarantee that it will result in a full-term pregnancy, but the chances are fairly good. How long does this process take? It is a very lengthy process. So from the first consultation with the PGD service to embryo transfer is about 9 to 10 months. And most people say it's about a year from the beginning to end of this process. And by far the longest part of the process is the setup for the procedure. So the first appointment to discuss the treatment, application for funding, which I'll talk about, collection of the DNA samples, any preliminary testing, and referral to the ACU. The treatment itself actually is actually the shortest part of it. It only takes about 4 to 9 weeks. And then once embryos are available to biopsy, the testing takes another 2 to 4 months, depending on the condition. And then once that happens and the frozen embryos are available for transfer, that's when this cycle is over. So it takes about 9 to 10 months until the embryos are actually transferred. So in the UK, who's eligible for PGD? There are certain criteria which vary, depend on whether you're seeking funding through the NHS for the process or whether you're self-funding the process. So since April 2013, NHS England has actually offered funding for up to 3 cycles of PGD for individuals who are eligible for UK care and who meet a certain set of defined criteria. And so these funding criteria include things that will maximize the probability that the cycle will result in a successful pregnancy. So they want to offer it to people where there's the greatest chance of success. So the female partner has to be under age 40 at the time of treatment in order for it to be NHS funded. She also has to have a BMI of between 19 and 30 because that maximizes the likelihood of successful transfer. Both partners have to be non-smokers, and that includes e-cigarettes. And the couple has to have no living unaffected child from their current relationship. And that applies to England, Scotland, and Wales only. And I'll talk a little bit more about that towards the end. The couple has to not be seeking the PGD primarily because of infertility. It has to be primarily because of the genetic condition. And the couple has to have had genetic counseling from a clinical genetics service by either a geneticist or registered genetic counselor. And the couple has to have been in a stable relationship for at least 1 year and living together at the same address at the time they get the treatment. Not everyone meets these criteria. And so what are the other options for people that don't meet all of those criteria? One is for self-funding the PGD process. It's not inexpensive. Cost of self-funded PGD in the UK is about £12,000, and that's based on the cost at the PGD center we use, which is Guy's in St. Thomas. Patients must meet the following criteria in order to be suitable to pursue referral for self-funding. The criteria in this case are somewhat relaxed. So the maximum age is age 42 for women for self-funding. However, they also have to have sufficient hormone levels to make it likely that they'll have enough eggs for this process to be successful. The BMI has to be between 19 and 32. And like the other criteria, both individuals have to be non-smokers. They have to have had genetic counseling prior to the process, and they have to have been in a stable relationship for at least 1 year and living together at the same address. So what are some other PGD considerations? So we've talked through sort of the nuts and bolts of the procedure. What else would really factor into a person's decision whether to go through this? What if a person wanted to have PGD, but they haven't undergone genetic testing themselves and they don't want to know their own genetic status, but they still want to have PGD? This is possible by a process called exclusion testing. And what exclusion testing does is that for people that don't want their own genetic test results, they actually use markers around the CADASIL gene, the Notch3 gene, to look for chromosomes in the embryo which come from the unaffected grandparent in the family. So I'll explain this a little bit. So let's just say that the female partner is at 50% risk for CADASIL. What that means is that she will have inherited the CADASIL gene change from her affected parent, or the grandparent in this case. And so we can actually look at markers on these chromosomes from both her mom and her dad to be able to tell which chromosome comes from whom. And so when the embryos are produced, we can look at those chromosomes in the embryo and tell whether the embryo that she's passed down has come from her affected parent or whether it's come from the unaffected parent. And so they would only implant embryos which have the chromosome from the unaffected grandparent. So this is an option which isn't used very often, but is possible for people that decide they don't want to do the genetic testing themselves, but they want to have a child without the condition. So another PGD consideration, what if a person wants to have PGD, but they already have a child from their current relationship? This is problematic for adult onset conditions like CADASIL because we don't do predictive testing for children under the age of 18. So any child you have by a current relationship would be considered unaffected and you would not be eligible for NHS-funded PGD. But you could still pursue self-funded PGD if you met those criteria. And what if you already have a child, unaffected child by PGD, and you want another child by PGD? In that case, you can pursue transfer of any unaffected embryos that might be available from the paid PGD process. So if there are still unaffected embryos in storage, you can self-fund the transfer, and that's about 1,200 pounds per cycle. Otherwise, you have the option of self-funded PGD cycle from the beginning, which again would be about 12,000 pounds per cycle. So aside again from the technical aspects, what other things should people consider when they're looking into this as a possibility? It's a very lengthy process. It's physically challenging, especially for the woman, and emotionally challenging for the couple, even when it is successful, and even more so when it's not successful. So what I recommend is to read through some of the patient experiences on the PGD Center's websites to get a better idea of what the challenges are in doing the process. There is also, if a couple decides to go through the process, short-term counseling available through the PGD centers and the ACUs themselves. A lot of couples choose not to pursue a PGD referral as a result of all of these considerations. For instance, guys, PGD center, only about 50% of the couples who we refer actually attend the first PGD consultation. And sometimes that's a conscious decision based on, just looking at all of this and saying, I'm not really willing to go through this, although sometimes contraception fails and people become pregnant before the process begins, and that's not uncommon either. So what I would recommend for additional information and advice for anybody that's interested in this is first to talk to your local genetic service, to ask them any questions you have. There's also good information available on the Human Fertilization and Embryology Authority website, which I've put the address for here. The Genetic Alliance website also has a very good page on PGD. You can look at information available on your local PGD center's websites for more locally applicable information. And I also encourage you to talk to others who have had PGD or who have considered PGD, and that's something that's probably available through the CADASIL support network. So I'd like to thank you, and I'll be available for questions at the end of the presentation. And if you have any other questions, you can feel free to contact me at the website that I've given. Thanks.